Let's move on to RNA polymerase agents and other agents. Once again, we are talking about nucleic acid synthesis. But now we are talking about RNA as opposite to DNA. Phosphonate is probably the best known in this drug. It doesn't require phosphorylation for activity. It is not an anti-metabolite. Now it inhibits both DNA and RNA polymerase, and it also inhibits HIV reverse transcriptase. So it's kind of convenient drug to use for multiple situations. It inhibits DNA polymerase in Entecavir resistant strains that are also thymidine kinase deficient. So it's quite a useful drug in that regard. Adverse events are quite severe, so nephrotoxicity up to 1/3 of patients can develop a nephrotoxicity with this agent. So we tend to be very careful in monitoring renal function in people who are on this drug. Genital urinary ulceration can also occur in patients who are on phosphonate as well. So we keep an eye out for that too. In terms of nephrological side effects, patients often complain of headache. I see that all the time in patients that I co-manage with our HIV specialists who are hepatitis specialists. We also see hallucination and seizures with this agent on rare occasion. Let's move on to the other drugs. These are drugs that don't really fit in other categories. Ribavirin is an adenine analog. It has very good activity against systemic infection, HSV, VZV, and cytomegalovirus. It doesn't have any significant effect on genital lesions. It's more about a systemic infection treatment. The next agent that I want to talk about is formivirine. So this is an interesting drug. It is an antisense oligonucleotide. So to give you an idea of the size of this molecule, take a look at the Verdalabine in top right hand corner, and then take a look at the formivirine. You can see that it is a huge molecule, and that suspiciously looks like a DNA molecule, except its antisense is backwards. Now we use this agent intravitreously, so we actually put it into the eye for the treatment of CMV retinitis. The toxicity associated with this medication includes iritis, vertitis, and increased intraocular pressure from the physical presence of this agent inside the ocular chamber of the eye or the eye. Other agents are also used in herpes keratitis, and this is usually used as a topical treatment. So in terms of these agents that we are talking about, I just wanted to put this on one slide so that you can see in terms of those agents that are analog of the different components of DNA or RNA, you can see where they all fit into the armamentary. Remember that analogs of the different portions of DNA do have to be phosphorylated, where the agents don't have to be phosphorylated. Let's move on to a different category. This is the category used to treat influenza. Now, anti-influenza agents who work on several areas, but the one that we talk about most is the decloaking of the influenza A virus. Now, Amantadine is a prototypical drug, and it blocks the uncoating of the virus. It binds to a proton channel to prevent the acidification of the virus core. Now, without acidification of the virus core, you cannot activate your RNA transcriptors, so that virus is essentially rendered inside the cell. Now, it doesn't affect the influenza B virus. It tends to seem to only affect influenza A virus. Note that amantadine is also an anti-Parkinsonian medication. So we did talk about amantadine in our Parkinson's lecture. Amantadine does not require dosage adjustment in renal failure. So it is a convenient agent as well that is part of the armamentarium. In terms of the toxicity of these two agents, mostly it involves GI irritation, but sometimes you can get some strange neurological phenomenon to like slurred speech, dizziness, and ataxia. Is that due to the Parkinson activity of the drug? We are not too sure. The next agent I want to talk to you about in terms of influenza treatment is Zanamivir. Zanamivir. These are neuraminidase inhibitors. They act by cleaving sialic acid residues. Now, they prevent clamping of newly released versions. So normally, when viruses are being released or variants are being released, they clamp together, and we don't want that to happen. Now, these agents are inhibiting the neuraminidase. So what happens is that the virus aren't able to spread out. Now these are active against both influenza A and influenza B, and they are actually also each H1N1 influ. If you remember that made some headlines a few years ago, it's also active against H3N2 influenza virus as well. Worldwide resistance is actually quite rare, and we think that the worldwide resistance that does develop is due to mutations of the neuraminidase. So here is another category, anti-hepatitis drugs. So genus was mythical Greek god. Actually, he was an Olympian who had 10 heads. So we talk about the genus Canis as being those agents that seem to have a whole bunch of faces to them. Now the genus Canis is phosphorylated stat that stands for signal transducer and the activator of transcription, so it causes JAK-STAT receptor. And you can see the JAK portion down at the bottom. Now this causes an increased production of antiviral proteins. There is a specific activation of ribonuclear nucleus that degrades the viral messenger RNA when you activate these agents. This promotes the formation of natural killer cells that destroy infected liver cells. So that's why interferon alpha is such an important component of our immune system. Now, intramuscular injections interferon alpha, how we administer this medication. The formulations vary from time and place. Now the absorption is relatively slow. It's given about 2 or 3 times per week. We do have something called pegylated forms that can be given once a week. Pegylated forms are first to encasing the interferon in certain types of almost micelles or liposomes. The elimination is through hydrolysis and proteolysis in the kidney. In terms of where we use these medications, they are most commonly used in chronic hepatitis B. But we have actually used in hepatitis C as well, usually acute hepatitis C. And we often combine it with ribavirin. In less common uses, we are used it in Kaposi's sarcoma in HIV patients. We were also used in papillomatosis and genital warts as well, although that's actually much less commonly used. Now I have another category here called others under anti-hepatitis drugs. It's actually quite a large category. Now we already spoken about interferon alpha, so I'm going to go through it again. Now the other drugs that we use with hepatitis includes the DNA polymerase inhibitors, the nucleoside inhibitors, the broad-spectrum replication inhibitors, and another set of drugs that I just call miscellaneous. Let's take a look at the DNA polymerase inhibitors. The prototypical drug of the DNA polymerase inhibitors is Adefovir. It inhibits DNA polymerase of hepatitis B virus, which it results in chain termination after incorporation of the virus into the cell. It has good oral bioavailability and is unaffected by foods. You can do dose reduction in renal dysfunction because it is excreted by the kidney. It works quite well against viruses that are resistant to lamivudine, which is another antiviral agent that I will talk about. In fact, let's talk about lamivudine now. It is a nucleotide inhibitor, and if you recall, nucleotide inhibitors are working on that very important step of nucleic acid synthesis. It inhibits HIV reverse transcriptase. It is a very long-acting agent in hepatitis B infected cells. Compared to, say, it is limited activity in HIV infected cells. It is often used as monotherapy in hepatitis B. It is relatively non-toxic and it causes a rapid suppression of hepatitis B virus. Other agents that are active against hepatitis include the broad-spectrum replication inhibitors. You also know this is ribavirin, and it is actually quite a well-known drug. It inhibits replication of a wide range of DNA and RNA. It affects influenza A and B. It affects parainfluenza and respiratory syncytial virus. It also is active against paramyxoviruses and hepatitis C as well as HIV. In terms of the mechanism of action, we are not entirely sure how this particular drug works. We will believe that it acts directly with guanine transphosphate to somehow cause an inhibition and capping of the viral messenger RNA. It also blocks RNA-dependent polymerases, which is why we use it so often. Now, in terms of using this medication, remember that in order to improve its absorption, we actually want more acidity in the stomach. So we tend to tell patients to avoid antacid when you are taking ribavirin. It is eliminated by the kidney, so we have to act dose reduction if there is renal failure. We often use it with interferon alfa in chronic hepatitis C. Remember that monotherapy with this particular agent is not very effective. In terms of toxicity, there is a dose-dependent hemolytic anemia that is associated with this drug, and it is contraindicated in pregnancy. The miscellaneous drugs used to treat hepatitis patients include the following. Now we have nucleoside analog that works against the DNA polymerase. We have agents that are approved for lamivudine resistance. We have agents that inhibit RNA polymerase. This particular agent is quite active in hepatitis C virus, and we actually can achieve 95% cure rates when used in association with ribavirin. Boceprevir is also a proteinase inhibitor, and it is used with ribavirin as well.